Pathological gambling, also referred to as gambling addiction or compulsive gambling, is a severe mental disorder with profound impacts on individuals and their loved ones. It is characterized by a persistent urge to gamble, despite harmful consequences. People with pathological gambling may gamble to escape from problems or to relieve negative emotions, and they may continue to gamble even when they know it is causing them financial, legal, and social problems. This video delves into the 10 criteria established by the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, for the diagnosis of pathological gambling. Stay until the end of the video to discover tips on overcoming a gambling addiction. The symptoms of pathological gambling can vary from person to person, but they may include 1. Preoccupation with gambling. Individuals afflicted with pathological gambling display constant thoughts about gambling, extending beyond actual gambling activities. This preoccupation encompasses reflections on past gambling experiences, planning future sessions, and contemplating ways to procure funds for gambling endeavors. 2. Tolerance and increasing wager amounts. Tolerance, a hallmark of addiction, manifests in pathological gambling through the need to bet larger sums to attain the desired level of excitement. This escalating pattern of wagering reflects the progressive nature of the disorder. 3. Repeated failures to limit or stop gambling, relapse. A key feature of pathological gambling is the inability to curtail or cease gambling despite repeated attempts to do so. This recurrent failure underscores the compulsive and challenging nature of the addiction. 4. Restlessness or irritability during attempts to limit or stop gambling, withdrawal. Withdrawal symptoms, such as restlessness and irritability, emerge when individuals with pathological gambling attempt to limit or cease their gambling activities. These manifestations mirror the physiological and psychological dependence commonly associated with addiction. American Psychiatric Association, 2013. 5. Gambling as a coping mechanism. Pathological gamblers often resort to gambling as a means to evade confronting their problems or to alleviate negative emotions like anxiety, depression, or guilt. This coping mechanism further entrenches the addictive behavior. 6. Gambling for revenge. A characteristic behavioral pattern involves individuals returning to gambling in a quest to recoup losses suffered in previous sessions. Seeking revenge through gambling becomes a recurrent and counterproductive response. 7. Deceptive behavior, lying to conceal gambling. Pathological gamblers frequently engage in deceptive practices, including lying to family, friends, therapists, or others, to conceal the extent of their gambling activities. This deceptive behavior serves to safeguard the addiction. 8. Engaging in criminal activities to finance gambling. The severity of pathological gambling is underscored by individuals resorting to criminal acts such as forgery, fraud, theft, or embezzlement to fund their gambling pursuits, highlighting the dire consequences of the addiction. 9. Jeopardizing significant relationships. The impact of pathological gambling extends to jeopardizing or losing important personal and professional relationships. It draws attention to the substantial impact the disorder has on how individuals relate to and interact with others. 10. Reliance on others for financial crisis resolution. Individuals grappling with pathological gambling often lean on others to alleviate financial crises arising from their gambling activities. This dependency further perpetuates the cycle of destructive behavior. Causes. The exact cause of pathological gambling is unknown, but it is believed to be a combination of genetic, psychological, and social factors. People with a family history of gambling or other addictions are at an increased risk of developing pathological gambling. Additionally, people with mental health disorders such as depression, anxiety, or attention deficit hyperactivity disorder, ADHD, are also at an increased risk. Treatment. There are a number of effective treatments available for pathological gambling, including cognitive behavioral therapy, CBT. CBT is a type of therapy that helps people identify and change unhelpful thoughts and behaviors. Medication. There are a number of medications that have been shown to be effective in treating pathological gambling, such as antidepressants and mood stabilizers. Support groups. Support groups can provide people with pathological gambling with a safe and supportive environment to share their experiences and receive support from others who understand what they are going through. How to help someone with pathological gambling. If you think someone you know may have pathological gambling, there are a number of things you can do to help. Talk to them about your concerns. Let them know that you are concerned about their gambling and that you want to help. Encourage them to seek professional help. There are a number of effective treatments available for pathological gambling, and professional help can make a big difference. Be supportive. Let them know that you care about them and that you are there for them. Pathological gambling is a serious disorder, but it is treatable. With the right treatment and support, people with pathological gambling can recover and live healthy, productive lives. If you find this video helpful, please like and subscribe. Thanks for watching.